Welcome back to the Recovery Lab, and I'm your host, Joe Lemon. And today's guest is Dr. Grove Higgins. Now, he's based in Monument, Colorado, and his resume includes working with elite-level soldiers from the whole Green Beret 10th group, as well as UFC fighters and a whole host of athletes, endurance athletes, some Olympically trained athletes. So he sees it all. It really goes about educating athletes and just the general population about how they can maximize their bodies. So there's going to be a lot here for you guys to glean from listening to this episode. So without further ado, let's get into today's conversation with Dr. Grove Higgins. I really want to welcome Dr. Grove Higgins onto the show. And I got to set this up properly because we had a chance to meet. It had to be almost maybe 2.5 years ago, I think. Feels like 2.5 years ago. Maybe about 2.5 years ago. And so anyway, came down to your place, heard great things about you, just kind of through the whole grapevine. Drove down to your spot, Colorado Springs, and you were checking out your devices. So you wanted to kind of give us a look. And I was impressed with how you did your evaluation of it. A lot of people kind of just pick it up and ask questions, but you're like, wait. You just took it in like a different approach that after being in this industry for a good three plus years at that time, I mean, literally, I was like, oh, nobody's doing it like this. Nobody's evaluating products like this. I wish more docs would take this approach so they can just know objectively what's working for the person. And you guys measured the actual range of motion. And so, I mean, off the bat, I was a fan of what you guys were doing. So I want to welcome you onto the podcast.
Well, thanks a lot. No, I appreciate it. I mean, it's the most expensive relationship I've ever started. It's been wonderful for my patients, and I don't regret it at all. So.
That's awesome. I mean, so Doc, you know what? I mean, just so the audience can really get to know you a little bit. I mean, obviously you guys are at a beautiful place right now, but tell me how you started with your actual chiropractic journey or just getting into healthcare period.
Yeah. So it actually started a long time before I actually got my doctorate. I was a precocious practitioner back in the day. I was actually in high school. When I started working in hospitals as a physical therapy aide, really saw myself in the healthcare field. Didn't know exactly where, whether it was physical therapy or medicine or someplace else. And over the years, I got into personal training and working from everything from neurological rehab, so stroke victims and amputees, to performance athletes and such. And so by the time I was 20, I already had 6 years of experience, and I was doing primarily exercise-based rehab for both physical therapy clinics as well as eventually who became my mentor, Dr. Mike Leahy, who's a soft tissue guru and expert. And I started working with him and just saw a huge change in the way that my ability to get people better was when I had somebody that understood how the patient moved as a whole person rather than just, this part or this part, how the whole system works together and how that changes the outcomes for the patient. And so I decided to get out of the middleman position, get my chiropractic doctorate, and got into practice in 2006, and then made a quick little jaunt to Las Vegas as an inventor and working with UFC fighters out there for a short time, and came back, started a nonprofit working with wounded, ill, and injured soldiers, which really informed what you saw when you first came out, and then have been in private practice ever since.
Dr. Leahy in the very beginning, and he was the one that kind of turned you on to becoming that soft tissue expert.
Yeah, most definitely. And it just jived. The first time I saw him, he was speaking at a National Athletic Trainers Association meeting, and everything that he said just jived with how I thought about the body and everything, coming from my non-educated background at that time. And it just pushed me to want to work with him, to learn from people like him. And I've had great mentors because of that experience opening that door.
Yeah, I mean, so that makes a lot of sense of how you kind of got to where you are today, knowing what you're up to a little bit. And so, talk about that UFC fighting experience. Not so much you, right? I mean, you were just trying to take care of the actual fighters. Is that correct?
Yeah. Yeah, trying to fix somebody who takes the system to an extreme.
Right.
Whether it be a UFC fighter who is purposely putting themselves in danger all the time, or a soldier who trains for that all the time and takes their system to the uttermost experience of stress, especially if they've been in combat, and to see how the body breaks down and who survives well and who really gets broken, really informed how I look at how to rehabilitate the body and get it to, a more optimal place, so that way it survives better going forward, even if it was coming from a very broken place.
100%. I mean, man, talk about soldiers too, because, you're absolutely right. I mean, obviously people that go to combat, that's the most extreme case that anybody can even try to fathom, right? But even the trying to get ready is like, it can max out 99% of people out here, right? I mean, so, I'm just curious, just based off of your actual time working with just so many different soldiers, has the training, and if there's pain in their training, has that translated to them being able to deal with war times better or less?
Yeah, I mean, there's that mentality, and we see it in the exercise culture in the United States of no pain, no gain, right?
Mm-hmm.
And you're a wuss if you can't keep up, and if you report it or anything like that. And to a certain extent, in that environment, in the soldiering environment, you need to be able to push beyond what your body will allow you to do. So in that sense, there's a certain amount of virtue to it. But at the same time, so much of training is cumulative trauma. And so there's the point at which that ends. And knowing what good stress is, or what I call eustress, eustress, it's the Greek for good, eustress versus distress, totally different things. And even in the exercise world, there's a point at which doing distress is actually building somebody up. But there's a very fine line, and most of us don't know where that line is, and so we end up breaking ourselves down. So by the time somebody comes out of the military, whether they saw combat or not, they're broken humans. It's just the nature of the beast, and it kind of is necessary in that kind of environment. But outside, not so much, and unfortunately, most of us are just hurting ourselves.
But so maybe give some pointers to the people that are out there who might have that no pain, no gain mentality, and what's the right way to kind of maybe more so look at dealing with, overworking versus trauma that's happening to the body?
Yeah. So, in that eustress category, right? Exercise and that burn that you create and things like that, that's good. It's going to force the body to make changes. But at a certain point, just like medication, there's a decreasing effectiveness, right? So a medication curve is like this. You take a little bit and you get some improvement. You take enough and you hit the top of the curve, that's ideal, right? You're taking 800 milligrams of ibuprofen for this problem, you gain maximal effect, you're not damaging your liver, all those things. But when we go too far to the other side, now we're starting to break the body down. And, with medication, we know where those are, right? The doctor says, oh, you're a man of 175 pounds and you're active and you need this much. And he's trying to hit the top of that curve. Well, exercise is no different. We should be trying to hit the top of that curve. And what that takes is just what the doctor had. The doctor had the benefit of research to tell him where that optimal range is for this person right in front of him. And that's not the same range as it is for me. I'm a 200-pound man. That same range is not necessarily going to be optimal. And so I'm going to get decreasing returns on the not enough side probably comparatively to the 175-pound man. Same thing with the exercise. And so having an evaluative process to say, am I doing the right things and am I getting a result, right? Oftentimes we wait way too long to determine whether or not we're getting the result. And usually that comes out in I'm stronger and I can see it on the bar and things like that. But on a day-to-day basis, do you know you're doing the right things? Because you could be going down the wrong path, and until the numbers start to trend downwards, are you going to make a change? And that's a bad idea.
What's that line? I mean, well, I should more so ask this. How would a person self-test? Because it is going to be so different, right? Because what's going to work for you might not work for me, and then vice versa. So, I mean, how would you recommend people kind of look at what's the right, threshold for them to figure out what they're getting into?
That's a great question. There's a great story about Lance Armstrong and when he was training, and whether or not you agree with how he went about his training to stay at that top of the world class, 1% of the 1% or not, doesn't really matter. He still had great training,
Yeah.
right? He used something to push himself past what the human body is capable of, no doubt. But he still was training in a way that most of us never do. And one time somebody asked him, so what heart rate monitor do you use? And he goes, I never use a heart rate monitor. He goes, I used one for so long, I could tell you when I'm working out exactly what my heart rate is and be within 5 beats, right?
Wow.
So evaluative processes, having several of them to begin with is really important until you get to that point where you understand what it is that you're doing and you don't need to use it as frequently. So it's like, trying to lose weight. You could weigh your weight every single day and never see much of a change, and that's not very motivating. What would be better is to use that, and then also to look at your waist size, because I've known plenty of people that say, I'm not losing weight, but my pants are falling off, right?
Right.
Have multiple points of data coming in to say I'm doing the right thing. So the easiest things to do is start keeping a consistent log of those types of things. So like HRV, so like a watch that's looking at your heart rate and how it behaves over time. And then journaling. How do I feel when I wake up in the morning? Do I have pain? Do I feel motivated? Do I have energy? Things like that. Do I sleep well? Those types of things. Two very quick assessment procedures we use here. We use range of motion and we use strength that people can use on themselves to be able to assess whether or not they're getting a benefit from what they're doing at the moment. And they can also tell when they're hitting that optimal and when they're getting decreased returns on the negative side.
And the fact that you guys got so many different people with different backgrounds under that same roof, I think is what patients want the most. At least guys like myself are at least curious about, right?
Yeah. And then when you leave here, so like you're in California, when you leave here, the team knows who you are and they can still plug into you.
Mm-hmm.
Right? And that's what we really want to be able to do is create a team around each individual walking in, not just, they're coming for chiropractic work. They're coming for exercise therapy or something like that. They're coming for a team. And a lot of times they don't know they're coming for a team, but they still come.
Us being able to really track what we're doing it feels like that's where healthcare is going, right? With all the, everybody doing telemedicine and, you got to have some data there that you can kind of give someone to help you out. And so, yeah.
That's helping our patients that we work with and our clients online right now, because they can give us really precise feedback as to what's working, what's not. We don't have to rely on them saying, I think I feel good or better anymore. They can say, yeah, I've been doing the drills. It's been getting better. This one has fallen off. And they are, from the standpoint of self-reporters, they're the best self-reporters. And so we're able to go much, much further with them in one online session than a lot of trainers do personally in every week with one person.
Seeing what you and Pat are doing from a soft tissue standpoint, corrective exercise standpoint, that combination seems to be killer. Can you talk a little bit about why you kind of took that approach into your rehab?
When I was working as really strictly a manual therapist and working with people, some things, it just frustrated me. Some people I could see with virtually the same problem, two people with virtually the same problem. This person I barely look at and they get better and they think I'm a wizard. And this person over here, I throw my best at them, and things are just changing ever so slightly. And that was always very frustrating to me. But I had a couple of really powerful instances, both female athletes, both wrists for some reason. She had shattered her forearm, unfortunately, in the CrossFit workout where she fell backwards over something in the environment, took the bar down with her, and it exploded her forearm.
Oh, man.
So plates and pins, the whole 9 yard. And she's a kettlebell expert, international, and she could not turn her wrist all the way over. And I'm working on her. This is months after her surgery. Her doctor said, don't worry about it. You'll never get that range of motion back. And again, I'm just doing light work and nothing's quite working. And then I finally get some range of motion. I have her drill it, doing the best I can based off from the learning I had before. And her range of motion would just lock down again and then lock down again. And I'm like, maybe it just needs more volume. So let's push the button as many times as we can. And it would change and then go back, change and go back. And then finally, all of a sudden, I recognized that I'm not speaking her body's language. Her body's language was of high, high intensity. Everything she did was high pressure, high tension. And so I do my treatment, we get the range of motion back. And so I have her do the drills that I want her to do, high tension, high pressure, fixed, stayed from that point forward. I need to speak the language of the patient's nervous system. I can't just treat it like a structural problem every single time. That's really what's informed how I've gone in my career as a chiropractor, soft tissue injury expert, and rehabilitationist.
That speaks volumes to why people need to really understand their bodies better, right? And kind of what their everyday life looks like. I've never heard someone kind of put it like that before. Speak about, just trying to speak the actual language of their body based off how they train, it seems like.
Yeah, and so then we get something like the piezo wave, which you brought into my life, thankfully. And because we think that way, we look at that tool differently. We look at it from what you tell us how it's supposed to work, but then we're like, how else is it affecting the body? And then we start seeing these other effects, and then we are able to use it much more effectively. It's become more of a diagnostic tool for us than a strict treatment tool, and it's been fantastic.
One of the things I saw you do after we treated you, I think maybe we treated your shoulder, or we just kind of played around, trying to give you some feels, and you went immediately to go pick up a straight, probably it had to be at least a good 50-pound kettlebell, and you start going through some movements. And that's not what I saw most of my people do. Most of them would stop and then do some laser therapy or rest it, and then kind of wait and then train it. But I mean, I thought it was a great way to really test out whether it was doing anything to the tissue. Could you talk about why you kind of chose to kind of test it in that method that you did after doing one session?
How I came about that? Well, I knew before I ever had you treat me, I picked up that same kettlebell to see how did that press. I knew the press worked, but I didn't know, I knew it didn't feel well, right? So if it was going to make a change, I wanted to see an immediate change, even if it was transient, because if I could make a change now and I could push that button to make the change, eventually it's going to become permanent. So I just chose something that I knew that I could do well, and I had enough experience behind it that I knew when it would change, that it did change. And it wasn't just, I'm not looking for, I think that feels better. No, I'm looking for that, that was a substantive change that I want to repeat. And then if I can repeat it on me and I can repeat it on patients, which we got 100 over the course of the 3 months that you let me borrow it for, we got enough data to say, yes, it was worth it.
I think it's important to have that data, though. I mean, especially with something that's newer to the marketplace, don't get me wrong. I don't want to bash any devices that I see out there at these different shows, but, there's some great tools, and then there's some skeptical stuff, and then there's some stuff that everybody knows. It's just like, all right, that's not going to do anything. But so, having a process to kind of look at it where you can get some honest feedback, I think is valuable and almost necessary.
Yeah. Oh, most definitely.
So, I want to talk a little bit about everyone being inside, because I think the trauma that people are going through might be a little bit more emotional trauma. People are not nearly as active, probably, unless you're pushing yourself and trying to train yourself. How would you recommend people deal with this space that we're in now? Most people are at home binging out on Netflix shows. You're probably tired of that. You're probably pacing around your kitchen. How would you deal with any of this sedentary pain?
Yeah, this is such a cultural shift for the whole country, right? We're not used to being stuck at home, unable to do things, for all intents and purposes, powerless, to do anything. So, there's a couple of different stresses. One, there's the inactivity stress, which you're talking about. There's the social isolation, so not being able to connect with the people and the places that give you mental clarity and happiness and things like that. And then not being able to engage in the things that made you feel vital. So that's a lot of distress right there. But it's also been a great opportunity for so many people, including my own self, to push my understanding of myself and to find a new normal that I can take forward. And part of that has definitely been that isolation, inactivity, stress, and discomfort and everything. For most of us, we don't have gyms in our houses. And we've gotten so used to the industry telling us you need to have a gym, you need to have, this equipment and such like that, that we forget that the human body and space can do so much all by itself. And in fact, that's probably the part that we're missing that is making most of our activities when we are in the gym and when we do have the equipment less effective. And so the biggest thing is start getting into a movement routine. So one of the things I did for my 15-year-old, he's 15, he's 6'1", and he has the genetics to be a gorilla, right? And so I downloaded a whole bunch of stuff from one of my strongman heroes, Eugene Sandow. He's old black and white photos of this man that looked like a Greek god. And most of what he did was lightweight body movement stuff. And so got him doing it. And he has just loved it so much. You see him just fall down and start doing sit-ups and push-ups and doing some of the calisthenic work. And you can see his body changing. And he's not touching a weight, right? Wow. Or at least very little weight. I mean, the most that he has at home is a 50-pound weight. And that's one, right? And he doesn't have two for both hands or anything like that. And he's becoming that gorilla. I put him up against just about anybody in the gym right now. But even if you're older, the same principles apply. Move well with intention, and you will change things significantly. And you'd be surprised. You can fix pain that way very easily.
Yeah. I mean, that's the part that is kind of beautiful about this time. It's like a master reset for everyone. It's like you have to kind of get back to level set. You got to figure out how to move your body properly because, I mean, let's be honest. Most people are going to go to the gym and load up the bar with something that the body's not really ready to move yet. And then they'll be coming just to kind of see you in a little bit, right?
And that's what we try to do with people when they come in here too, is say, okay, what got you into this problem? What caused this pain that you're coming to see me and pay me for? And let's not keep doing stupid stuff. And for most of us right now, it's changing our mindset. We want to get back to the gym, but I would love to see people attack the gym differently and not use it in such a linear fashion.
I think that's going to happen, especially with some more, out here like in LA, we operate a little bit different than the rest of the country. California as a whole, I feel like, is its own separate world at times, good or bad. I think with all the distancing that's going to be happening for some time, going to the gym and just being up in a room with 50 people is not probably going to be the way that we operate for at least a little bit. So I think people will have this opportunity to kind of get back and try to figure out how to move properly. But let's transition a little bit to what you're doing now currently at your current clinic, because I saw it once it was first opening up. There were still studs up and you kind of laid out the vision. But do you mind just kind of telling everyone exactly what you guys have going on down there?
Yeah, so several years ago, we hooked up with a concierge medical practice called Flying Horse Medical. The reason that we hooked up was that they sent us a few patients that were, kind of hitting the wall with their physical therapy and other things that they were doing, having pain. And so we started working with them. And we did some reciprocity. We sent some patients their way, and we started seeing just some amazing results. So over the last several years, we've been working towards this integrated environment where we have our own little clinic here, but on the other side of that wall is a world-class concierge medical practice that has allowed me to help people that I could not help, and because I have a doctor that I can work with and dialogue with, that allows us to dig deep into a person and solve problems. So we started looking at where we were going to do this, and we decided not in Colorado Springs, but in Monument, which is about 20 minutes north, because we see so many people from the Denver area. They'll travel 50, 60 miles or more to come down to the Springs to get what they want. And so we started this. Really, the focus of our clinic is, again, to empower people to make change. Yes, they're coming in, 90+% of them are coming in with a pain issue. That's why they're seeking us out, that they can't fix anywhere else. And they come in, but by the time they leave, even off the first one, they're bought into the mindset that they have the ability to change this problem day by day and move beyond the problem. And that's another place I'm very proud of what we do. We're not so focused in on the problem that the relationship ends with the pain. Right? It goes beyond the pain. And ideally we get to that point where they're like, what else can I do for myself now? right? And so then we end up seeing them because they want to take their bodies and their life to a new level rather than, well, we'll see you when the next thing falls off.
well, I mean, and it's great that you guys are taking on that approach, because a lot of times healthcare is messaged out to people with, hey, it's just sick here. Once you get sick, then come see us. And then once you're not sick, get back to it. And then once you get sick again, and it's just a vicious cycle of, of getting sick, see your doc, then go back on the world, get sick, see your doc. So I love the idea of helping people become optimal with like health, because if we move past just the bare minimum of like, am I sick or not, then I'm healthy or not. I mean, that's whenever this starts to get really fun, to me, at least anyway.
Yeah.
How'd you guys get to that?
It was coming out of working with the soldiers in the nonprofit that we had, LifeQuest Transitions. It was a non-clinical scenario. I was a chiropractor, yes, but I wrote the curriculum to say, how do we take and teach a soldier the skills of how to make internal changes, changes in their ability to move well and pain and such like that, and teach them that those same skills are the skills you're going to use to transition into life from this stage of your life that's closing. And so it was very hands-off in the sense of we were training them, we weren't treating them. And because they had great medical already, they didn't need more of that, right? And so we got into this mindset of, okay, so how can we empower the soldier, give them this new experience? And we saw such great results. In fact, we were getting calls from their doctors at the hospital, at the Army base at Fort Carson, calling us up, and they're like, we don't know what you're doing, but keep doing it, because everybody that participates in your program gets better in their therapies with us.
Wow.
Better than anybody in the clinic. So we kind of encapsulated the learning from that, and we brought it into the clinical setting, and that's really the basis of everything that we do. Yes, I'm still a manual therapist. I still am a chiropractor, and I adjust and I do soft tissue work, but that's really to take away some of the roadblocks to being able to use this empowerment model with good techniques. Don't get me wrong, we got good techniques, we got really solid protocol and stuff like that too, but and things like the piezo wave, but those tears down the roadblocks, and then it leaves them able to move better with more motivation and see results and be able to track those results that allow us to go into that performance model rather than stay in the sick, broken model.